we are still talking about hernia epidemiology in Ghana, a surgical aid for people living with hernia. Now, let's talk about this. With the volume of cases you have mentioned, how does the foundation intend to provide support for this number of people across the nation?
Oh, okay. You know, when the data, initially when we started, we didn't even think there was a data or there was a society that was focused on the challenge. But along the line, because it's a sector we've delved into, we began to find other people who are also on that sphere. So, but when we launched, that was in August, 26th of August, the National Surgical Aid Program, we thought about how we could actually come with a strategy to go nationwide. And then we had a meeting with the Ghana Hernia Society. And then they are an association of surgeons who are basically located in regional and teaching hospitals all across Ghana. So with this partnership, we will be able to reach out to every corner of Ghana. And the basic problem is the financing. So that has been the challenge. So what we are doing is to put strategies in place to raise the funding and then also put it out there to the surgeons who are actually located in all regions of Ghana. So that's the synergy we are looking at now. The Ghana Hernia Society currently is focusing on training medical officers on how to repair hernia using the mesh technology. Right,
there's some group of people I'm really worried about, those in the prisons, especially in Sawim. Have you been there?
Okay, I have been to Isawam. Doc has put me on a mission to Isawam, and I have spoken to the MC. I have tried to reach out to the Municipal Health Director. So what I'm waiting for them, we've sent in everything we want to do there. So we are waiting for them to actually give us the leeway, and then we can move in and then see how we can start supporting people there.
Okay, so what should we expect in 2023?
Okay, in 2033, there are a number of things. We want to go nationwide with the Operation Fix Hernia campaign. Okay. Yes, we want to go. So we...
before it can kill, right?
Yeah, it can kill.
Okay.
Obviously, if it gets complicated, for example...
If it's not treated.
Yeah, if it's not treated and it gets complicated, it can kill you. For example, if it gets obstructed, that is, if the intestines get kind of blocked in the loop, or it loses blood supply to the intestine, it can get serious and it can kill, yes.
Same for women and men?
Same for women and men, even children sometimes.
I see. Let's come back to that.
Yes, so we are working on that vigorously. We want to see how we can take up that in January or between January and February. And then we've been talking with, that's the president of the Ghana Hernia Society, that's Professor Michael Ohineyeboa. Okay. Yes, and then I'm sure that between this December and January, we would have concluded on our collaborations and how we want to operate together, and then we can take off. Another thing is that we are also going to move from hernia to fibroid intervention as well. So that's another thing in line for 2023. And then we are also looking at the Shelter for the Homeless project. Yes, currently a well-meaning Ghanaian has actually donated a facility for that purpose at Kaswa. So we're trying to put all the nitty-gritties together so that we can start from there. We're also looking at other locations because I'm sure people would not be able to travel, people who are homeless will not be able to travel from Accra Central to Kaswa. So we're also looking at other avenues we can establish something closer to them. So these are, and then we'll also make that also a nationwide project, especially in cities where you have people abundantly who are living on the streets and then don't have a place to stay. And that project is going to have an in and out phase. So the in phase is when we take you in and then we'll put you through a program that teaches you financial management so that by the time you've been there through, you'll be able to save money, get your own place. Because these people, they do one or two things on the street that earn them money. So you come in through the in phase through the program. We'll partner with some savings and loans company and then we'll do that so that you can now own an actual business, own a place of your own, and then a space is created for other people to come in as well. Then we also are thinking of setting up a specialized clinic where we can now begin to reduce the cost of everything we do to hopefully zero.
I was just coming to that. All these interventions you've spoken about, the surgical process and all of that, is it for free?
Okay. So basically what we do is that we cover up to 70% of the cost and the patient covers 30%. Okay. The 30% is invested into, the theater we are currently using is in ours. We are collaborating with a facility on that. So we some of that cost, the 750 goes into medications, like the painkillers. Doc will talk more about that and all that. And then we also for usage of utilities and all that. So that's what it basically goes into. So we take care of the 70% and you take care of 30%. So that's how we're doing it. For now, until we actually get out of funding. So that's why we're also thinking of setting up our own clinic, a specialized clinic, where we can basically afford to do this without incurring any cost.
All right. Yeah. So where are you located? Are you on social media? We have just a few minutes to go.
Okay.
So
we are on social media. We have a website. We are active on all platforms.
Contact numbers.
Contact numbers.
Okay. All right. So our landline is 030-296-2748. 030-296-2748, and then you can reach me personally on 054-680-6650. So those are the contact numbers. We are located at Amasam and Maira Junction, opposite the Agric Land Park at Pokwasi.
Okay.
That's
but your
our partner.
So our website is www.humserve.org, and then you can find us on social media, Facebook. You can find us on Twitter. You can find us on Instagram and YouTube. There are a lot of videos.
HUMSERVE.
Yes,
Okay,
HUMSERVE.
so
Humanity
you
Services.
wanted to say
So I was saying we've also partnered with some hospitals. Uduman Polyclinic to start with, and then Kemet Hospital, headed by Dr. Into and his team. So these are some of the hospitals we've partnered with so far. So you can come there, we can assess you, and then see how we can help you.
Right. Thank you so much for educating us.
Can I just spare a minute of your time? So we are also, the very last one, we also implemented the medical aid scheme, which has a focus on general society, especially children in schools. You know, children, they come together and then there are a lot of communicable diseases and all that. So we also...
You'll be tackling all of that?
All of that as well.
Sorry to chip in. So we have actually embarked on some school programs. We've done 3 or 4 schools where we've done screening for them. We've had a mentorship program for them, and we've also instituted some reproductive and then mental health programs for them.
Okay, thank you so much for coming.
Thank you too.
So I have been speaking to Dr. Prince Kwame Darko. He's a managing director, HUMSERVE Foundation, and also George Kwame Ega. He's the head of operations, HUMSERVE Foundation. This is where we draw curtains on this morning's edition of the Breakfast Live Show. My name is Lebene Abroko.